There are some factors or some things that could increase your chances of conceiving twin or carrying multiple pregnancies naturally, and we are going to dwell on those factors extensively in this video. Okay, there are two types of twins. Okay, first you have the identical twin. Second, you have the fraternal twin or non-identical twins. The identical twins, those set of twins that have the same features. Okay, they have the same gender, they have the same facial features, physical features, everything. They look identical from the name, identical. They look pretty much the same. You can hardly tell them apart. While the non-identical are those set of twins that do not look alike at all. And the non-identical twins makes the most of the twins you see out there. The identical twins result from fertilization of one egg, okay, by one or single sperm cell. Okay, this is an egg, for instance, and this is a sperm cell. So the sperm cell fertilizes this egg. Okay, at some point during fertilization, this fusion decides to divide into two again to produce identical twin. That is why they are identical, because they came from the same egg and the same sperm cell. If that fusion, if that zygote decides to split over again and over again, it gives more identical triplets, quadruplets, as the case may be. But these sets of twins are not quite common. They make just about 1/3 of the population of twins you see out there. While for the fraternal twin, they result from fertilization of 2 eggs by 2 sperm cells. These are 2 eggs, while these are 2 sperm cells. Okay, this sperm cell will fertilize this one, while this other sperm cell will fertilize this one. So this will result to non-identical twin. They do not look alike, they don't have the same features, but you can tell that they are siblings sometimes, but they do not have that identical look alike. Okay, they may come in different gender, either a boy and a girl, or they may be the same gender but with different facial features of different body type. Okay, while for the identical, they usually come in the same gender. As a couple, your chances of getting pregnant with twin is higher if the woman has a family history of twins. For instance, if the woman's mother gave birth to twin, or the woman has aunties that gave birth to twins, or the woman herself is a twin, then you could be expecting multiple pregnancy because there's a history of hyperovulation in that woman's lineage. Hyperovulation simply means that the woman releasing more than 1 egg at a time. But if the man has a family history of twin, this will not automatically increase your chances of multiple pregnancy, because it is the number of eggs the woman releases that determine your chances of getting pregnant with twins, not the man. You may be from a family of twin, or you yourself as a man, you are a twin. This will not increase your chances of having fraternal twin, because it is the woman that should release multiple eggs for your sperm cells to fertilize. But if you have daughters, you may pass that gene to them, and this may increase their own chances of giving birth to twins later in life. Take note, there is no genetic link for identical twins. Okay, science has not been able to come to a conclusion or provide evidence that suggests if you can conceive identical twins naturally. I think that should be something by chance. Okay. The next natural factor is age. As a woman advances in age, eggs need more stimulations to get matured. So there will be increased level of follicle stimulating hormone that will stimulate the maturity or production of egg. By so doing, multiple eggs may be released occasionally. Women in their 30s and 40s have a higher chances of giving birth to twins, up to 40% per 1,000 births. The next factor is race or region. Okay, the race or the environment you are from may predispose you to multiple pregnancies. There are some parts in the world that have a higher chances of giving birth to twins, such as the sub-Sahara Africa, for instance. They have up to about 23% per 1,000 births. USA has about 10 to 20% per 1,000 births. Asia has about 5% per 1,000 births. So if you are from this region or this area, maybe you could be expecting twin pregnancy, or you could be expecting twins. Okay, a study has shown that blacks or people from Africa has the highest number of twin pregnancy, or has the highest number of twins. Study has shown that Nigeria has the highest number of twins. There's a part of Nigeria in southwest region that have the highest number of twins in their community. They are Yoruba by tribe. It has been shown that they have up to about 45% of twin rates per 1,000 births. That is quite high. So this brings me to my next topic, which is diet or food. In this part of the country, the Yorubas, it is believed that one of their reasons for conceiving twins could be linked with their food. There is a particular food called yam that they eat almost every day. It is their staple food. People believe that this particular food may cause hyperovulation, okay, because yam contains a hormone called phytoestrogen that could increase the stimulation of multiple eggs. Another food that researchers believe may increase your chances of multiple pregnancy is dairy products. Example, cow milk, for instance. Some researchers believe that your chances of getting pregnant with multiple pregnancy is higher, particularly if you are from a region where cattle receives growth hormone. There will be increased growth hormone in your system to further increase the stimulation of your ovaries to release multiple eggs. It is not a conclusive fact. The next one is breastfeeding. I know breastfeeding your child for the first 6 months exclusively can actually suppress your fertility hormones, right? Yes, you can also get pregnant while breastfeeding. A study found out that twin pregnancy rate was higher in women that breastfed their babies, about 11.4%, while women that did not breastfeed their babies had just about 1.1%. A hormone called prolactin, which is responsible for your milk production, increases significantly during your time of breastfeeding, and this hormone may cause hyperstimulation of your ovaries. You see, that could just be the reason. It can go both ways. This hormone can suppress your fertility rates by giving you natural family planning. It can also increase your chances of multiple pregnancy. Life is a mystery. Next natural factor is your body size. If you are taller than the normal average, then your odds are higher. But there is no clear explanation to this. One study found out that women with a greater body weight, or women that have some fat in them, more fat in them, has a higher chances of producing more estrogen that could stimulate their ovaries to produce multiple eggs. Okay, so while trying to get more body fat, if you want multiple pregnancy, also note that being overweight can also bring about factors that could make conception more challenging. The other factor is stopping birth control. If you have been on birth control, maybe for instance pills, okay, and you just stopped it, your body will try to readjust. Okay, there will be some ups and downs in your hormones. So during this period, sometimes it may just cause hyperovulation. Where we are done with the natural factors, was the stopping of pee part of the natural factors? Well, that is left for you to decide. But let me just chip this in. All these factors I have mentioned, they are not 100% reliable. These things are just factors that could increase your odds. So the only thing that could actually increase, like double your chances, is IVF, okay, in vitro fertilization. So if you are undergoing such procedure where they will have to fertilize the eggs outside the reproductive tract of the woman, you can increase your chances of multiple pregnancy through that procedure. They may put into your body more than one embryos. That is not also 100% reliable or accurate, but it is close to a 60% chance. If you are undergoing some fertility treatment, maybe you have PCOS, some medications that they are using to take care of you, example clomiphene or clomid. Disclaimer, these medications are solely prescribed by a physician, okay? So like clomid or letrozole, if you are on fertility medication, your chances may increase, okay? You may have a double chance. Some people will say taking folic acid. Folic acid actually does not increase your chances of multiple pregnancy. In fact, it does not even help with pregnancy. It is recommended for you to take if you are preparing to get pregnant. At least start taking it 1 to 3 months before getting pregnant, so that you have enough in your system to prevent some birth defects like neural tube defects, okay? Overall, any woman or every woman can actually be pregnant with twins, but some have higher chances than others. If you have watched to this point and you have not subscribed, why have you not subscribed?